Very good evening to everybody. Thank you so much for taking out time and making yourselves available for the session here. We already have our guest on board, Dr. Fazal. I'm Namita, and I do these talk sessions for Humanizing Lives. So we all have spent our 2020 pretty much locked into our own houses. The life changed in a snap of a finger. One day we were celebrating Holi, the next day we were locked in, and we were locked in for a year. And 2021 started out on a very, very hopeful note. It started out on the note of recovery for the economies, for the nations, and also for our freedom. We were allowed to go back to, very regulated normal lives. We were also given permission to, get back to our work life, etc. But the vaccine with it brought in a lot of fear in people's minds. It also brought in a lot of apprehension, obviously, because none of us in our lifetimes, even our fathers and grandfathers in their lifetime, remember anything like this where people were forced into being locked into their houses. So just as much as the scare was around COVID, equally huge is the concern and apprehension related to the vaccine. So today here we are discussing with Dr. Fazal the myths about COVID vaccine and the kind of pros and cons discussion that is going on within the society itself about the vaccine. He's going to break the myths, and he's going to bring out a more realistic picture to us and our audiences today for the benefit of the people. We work towards a betterment of mental health, and any kind of concern that surrounds your life becomes directly our lives concern as well. So I welcome you aboard, Dr. Fazal. A very good evening to you.
Good evening to you as well. That was a nice introduction about what COVID has done to our lives and how we are looking forward to make it better.
Indeed, Doctor. So, Dr. Fazal, before I can move on with the conversation, I would request you to please let our audiences know a little about you.
Yeah. So my name is Dr. Fazal. I have just finished my DM infectious disease a couple of years back from All India Institute of Medical Science in Delhi. I work as a consultant in infectious diseases in Manipal Group of Hospitals, Mangalore. My keen interests are in tuberculosis, HIV, fungal infections, and viral infections. And in the last year, we've seen close to 800,000 cases personally of COVID-19, especially the most severe ones in the hospitals around. So this has been my introduction, and I love talking about and discussing about healthcare issues because they directly impact the lives of the millions who watch. And the fact that with knowledge comes greater power, and I think that is something that we need to share with other people. Many times what happens is doctors know a lot, but they're not able to express it or talk in layman language to the public, and that's what causes more apprehension than making things easy in life. So that's why I'm here. Thank you so much for the invite.
Dr. Fazal, again, welcome to Humanizing Lives family. And thank you so much for taking out time to address the concerns. Your community has been one of the most celebrated communities, the ones who have been the heroes around us. And you are directly related to the stream of doctors that have become extremely relevant in the last 1 year in the US. You all are the key components of every kind of hazard management, the infection aspect of your profile that you're talking about. So I'll start with the conversation for today, Dr. Formally here from here on. He's an assistant professor as well in KMC, and he has specialized especially in diseases like these. And he has, gotten degree from the premier institute, AIMS, located in Delhi. And there couldn't be a better person to appraise us about every bit of the information that is official, validated out there. So, Doctor, let me start by asking you to let us know a little about this vaccine vis-a-vis the spread of the virus itself.
Yeah, so like many infectious diseases, vaccines are important components of making things better in the normal sense. So we have multiple trials because this was something that was very new for all of us in the human race as such. So everybody around the world was trying to come up with a solution for this big issue that we are facing now. And it's not that everything started in the month of December. The trials or the work behind the vaccine has been started as soon as March or April. That's 2 months into the 2 to 3 months into the whole pandemic. That's when things were just heating up in China when they're just receiving first few cases around the globe. So vaccines do work, and I think we have, as part of the country in India, we can surely vouch for it because we were suffering from polio for a long, long time, and we have just a few years back only we have been told that we have no more polio per se in India, but we still continue to vaccinate them because that's how important vaccines are. And if anybody or elderly is watching, you would realize that smallpox was once a big, big problem. We have managed that with vaccines. So there has been always an apprehension against vaccine because this is something that we give for people who are normal or people who do not have a disease. So there's more apprehension as to whatever foreign comes to the body. So if you're
Right.
sick, you're ready for everything, little more experimenting mindset. But if you're normal or if you're feeling normal, there is more apprehension towards starting something or taking something which is foreign to you and such. So in terms of vaccines, we in currently in India we have Covishield and we have Covaxin. These are the two that are available right now. In the future, we might have other vaccines also. So I think now this for the time being, I think we should stick our discussion towards what these two vaccines are because that's what we are going to get here. And yeah, that's about it.
So, Doctor, is there a difference between the two varieties of vaccines that we are talking about, or is it just the nomenclature or the companies that are producing them, their specific names that
So
are?
so there are certain differences. Covaxin is actually a killed vaccine. Covishield, on the other hand, is not a killed vaccine. Basically, what Covaxin does is it basically kills the vaccine and makes it less infective. Basically, it's like a smaller or a milder dose of a poison, so it gives you some kind of immune response once you take it. On the other hand, the Covishield is actually the virus particles are inside an adenovirus, which is another virus, which is not going to multiply. So it's somewhere in the middle where it is killed and live, but it won't multiply. So there's no risk of getting infected with the vaccine. Now that there's a lot of query whether we will take the vaccine, will become infected by the vaccine itself.
Right.
That generally is not a concern with such vaccines. That sometimes happens with live vaccines. Uh, these kind of vaccines, live vaccines, have not been given any kind of importance these days. So we have these vaccines which would not be causing the disease per se, but it will just train our it'll train our immune response in the body to make sure that they know whom to attack when there's an attack with the virus in the future. So basically, it just tells the body that these are the bad guys, and when you see them next time, you have to have a good response to it.
Okay. Um, Right. So the next thing that I would want to ask you, because most of the concern here is related to the fact that something is being injected into your body, and people are apprehensive about the reaction that body is going to have because this is recent. You talked about polio, you talked about smallpox. These are vaccines that took a really long time to develop, and virus has a tendency to change. So another concern that most of the people have is whether or not this vaccine is going to have a side effect, because long-term testing is what really tells us whether or not the vaccine is suiting a certain population.
Yeah, so in terms of side effects, the immediate or the short-term side effects have been very, very minimal. These sort of side effects have also been seen with other vaccines that have been there, influenza vaccines and pneumococcal vaccines. So these are not something that you should be really worried about. Basically, it's a trade-off between what you get and what you have to lose. What you have to lose is probably a day's work, or you might just have little body ache and fever, and you're not able to concentrate on work for half a day. That also happens very less than 15% only. In terms of what you gain is a decreased chance of death, decreased chance of severe diseases, and a decreased chance of getting infected in the first place. Disease, you're having the disease in the first place. So what you gain, the benefits outweigh the risk by a huge
Oh,
margin. I understand that there's always this apprehension going to be there. It's not just for this vaccine. It's been associated with, say, autism in kids and different kind of theories are there. And therefore, you would have, if you know this, a few months or a year back, US had a big outbreak of measles. Now, you don't hear all that in India because everybody gets a measles vaccine. Because of patients who are not vaccinating, or people who are not vaccinating their kids against measles vaccine, there's a big outbreak of measles. And that led to a long-term complication of infection process. Mind you, even people who thought that getting COVID and not dying or not being very sick, there are people who have come to the hospital and telling you that they are still not 100%,
mm,
even though they were not very sick with COVID, but they were long-term COVID or long COVID per se, where they have issues with smell, they have easy
mhm.
fatigability, or they get tired. So these are the things that you are going to benefit. All the risk factors for all the concerns about not getting COVID vaccine will be coming down with the benefits that you see. And the side effects in the terms of there's no major side effects. And anaphylaxis, for that matter, suppose you try a new kind of chicken, or you try something new in the hospital or in the hotels, there's an anaphylactic reaction to that also. The drugs that you take, the antibiotics you take, the paracetamol you take, there's a risk of anaphylaxis in everywhere. So that risk is always going to be there. But as I said, the benefits will outweigh the risk. So therefore, I think it would be making more sense to really think of vaccinating yourself.
Right. So, are you telling us that the short-term side effects have already been identified and they are something that one should not worry about? Is there any note or is there any concern amongst the community of researchers about long-term side effects that this vaccine could have?
Not really. So the short-term effects have been studied in thousands and thousands of patients. All the vaccines that have been studied have been given for 10,000, 20,000, 30,000 people. So there have been no short-term side effects. The long-term side effects, we don't expect them in terms, because in other vaccines also there are no long-term side effects, and so there is no concern among researchers or infectious disease specialists regarding the long-term effects. Having said that, it doesn't mean that nothing's going to happen, but the chances of something going wrong, horribly going wrong, is very minute. Again, I said, if you look at the benefits versus the suspected, so something that is threatening you right now is the pandemic, and you're worried about something that can happen in the future. So I think if you look at it that way, you would gain more from vaccinating rather than thinking about what the long-term side effects of concerns would be. But having said that, all the vaccines that have come till this time have no long-term effects, and therefore we don't expect a long-term side effect of this vaccine also.
I just sort of started feeling really relieved. But bringing our concern back to the variety of curious questions that people have, Doctor, I would also want to know, let's say some people have gotten themselves vaccinated. Does that mean that they can go back to the regular life and not have to put up with the restrictions like the mask or sanitizing the sanitizers around them? Some people had been so finicky, they had multiple bottles if they were traveling with spray and this and that. Will all that be gone from our lives for good?
Not really. So what this vaccine is going to do is prevent you from developing a disease. It will not stop the virus coming into your nose or into your throat. So that part can always happen. What it will do is make your body immune or make your body prepared for a disease like that. So this vaccine is mostly going to be protective towards you as such. Also, because you will not develop symptoms and you're not going to be more severe, your chance of spreading it to the community or to your fellow members is lesser. So even if you take the vaccine, there is still a possibility that the virus will come and into your nose and into your throat, but you will not probably develop a disease. That's the advantage, really.
Okay.
So in terms of wearing a mask and having social distancing, that thing will have to continue. How long is anybody's guess? There are a lot of astrologers who said that by May India will not have any COVID, and then that happened in June, July, August, and we are still seeing cases. So that is anybody's guess. But wearing a mask and keeping social distancing will have to continue, because suppose there are five people in the room, four are vaccinated, the one person not vaccinated, and the vaccinated person has the virus in the throat and he transmits it to the person who's not vaccinated. The not vaccinated person can still have a disease. So that is what it will do. So if all five of them are vaccinated, then there is no issue at all, and therefore there is no chance of uh, diseases per se.
So these are vaccines that adults are getting. These are some of the very few vaccines that adult people have to get, in life. Let's say if somebody has gotten himself or herself vaccinated, will their regular life be impacted, or are there any, dietary restrictions? Or let's say if somebody is into alcohol, will should that be stopped for a while, or will that clash with the vaccine, or any of those concerns?
As such, there is people who drink alcohol on a regular basis have an decreased immune response to many things. So, alcohol in general for long term or regular use or abuse should not be advisable. In terms of vaccine, there is now no specific guideline saying that if you take the vaccine, you cannot drink alcohol. The idea is that the reason we're taking vaccine is for our body to be prepared. So if you hamper that by having alcohol or any other substitute which can decrease your immune response, would not be the best interest for the vaccine per se. So you're not really worried about a reaction to the vaccine with alcohol. You're worried about what are the other issues related to alcohol which can decrease the immune response per se. The person who's taking regular alcohol, I think it would be advisable to stop it, not only during the vaccination but on a regular basis also. So alcohol per se is a strict no-no, especially if you're taking on a regular basis. So occasional is it's debatable, but long-term and regular is definitely not advisable. So regarding vaccines, I don't think it should be any issues with alcohol per se. But to be on the safer side, I think avoiding alcohol for the few weeks post-vaccination or peri-vaccination time would be advisable. And
Okay.
dietary restrictions, please don't like go on eat. Today is Saturday evening, so go on eat whatever you feel like as long as healthy.
You make it sound so nice, Dr. Fazal. So my next question to you is, is there a particular group that should be concerned? Let's say a
Mhm.
pregnant woman, or maybe somebody with, recent past ailment of a kind, or a chronic disease, etc. Should they be avoiding
Yeah.
this?
So basically, the question is who should not take the vaccine. Currently, anybody who's less than 18 age group has not been advisable because we don't have enough data whether they'll work or not and how what the dose is. In terms of pregnancy and patients who are lactating, it's always a concern for anything in medicine because they're the last ones to be tested. Pregnancy per se is a relative contraindication. So if you live in a place where you're more likely to get COVID and get complications, you would be advised. But right now, currently in India, pregnancy and lactation are contraindicated to be taken. In terms of patients who are severely immunocompromised, the concern is not safety, that if you take the vaccine, something's going wrong with you. The concern is the efficacy per se. That means whether you take the vaccine, whether you will have an immune response because your immunity is so low. If you try to wake up your immunity, they might not wake up. That's the concern, basically. And therefore, they have been avoided in the initial phases as such. So patients who are on immunosuppressive therapy, especially Covaxin, the vaccine has been there's an instruction to avoid this. In terms of Covishield, if patients have diabetes, because once a person is above 50 in India, many of them have hypertension, diabetes, thyroid issues, and everything. So those patients were included in the Covishield trial as well. So I think those patients can definitely take. But again, if you're heavily immunocompromised, that means if you are on steroids or if you're on transplant patients, then probably we should just wait and watch, because uh, these are the patients who really need it, because these are the patients who are going to become complicated if they get the infection. But because of lack of data currently, they could be an option to just wait and watch and see how things move forward. And if we have more data in the future.
Oh, lovely. That's useful. Useful. Little peek into your world. Uh, will there be series of vaccines related to uh, um, COVID, like a course? Will it be periodic, or is one shot good enough for an individual?
So the immune response, how long does it last? Nobody really has an answer to that. What everybody is guessing right now is 3 to 6 months minimum. Uh, People who have the secondary infection rate after getting once infected is less than, like close to 1 to 5%. So that's the chance that you get really infected second time and also get complicated. So roughly 3 to 6 months, but the exact answer nobody really knows. I think only time will tell uh, how long will the immunity as such survive or be there in the body. Like influenza, because influenza per se, like we had swine flu 2009, they keep changing and they keep have a variety in them. Therefore, the vaccination should be taken every year. Whether this will be happening with COVID-19, nobody really knows. Hopefully not, because even when we had SARS and MERS in 2004 and 2012, there was no recurrent infection with these kind of viruses. So hopefully that should not be a problem, but only time will tell.
That brings me to my next concern, Doctor, here. So a lot of, because in the age of social media, every kind of news, every kind of reaction reaches a larger audience than it once did. There's no filtering. And some of us recently got to know that a lot of doctors are also choosing not to take the vaccine. Will that choice be open to all? Uh,
It is open to all. Currently, also, there are people, the doctors, the nurses who don't want to take a vaccine. Vaccine is all the time usually voluntary, except for when you travel to countries where yellow fever vaccine has to be taken. So currently, also the vaccine is voluntary. There are people who are not taking it. So that's why this program like this will help them understand, hearing from people who have knowledge about these things, and also understand what is at stake. So it's just a basic benefit versus risk ratio. The benefit would obviously outweigh the risk, uh, but I myself was apprehensive to begin with. So once you start reading stuff, once you start scientifically approaching the problem, you realize that it's much simpler than what it appears to be on face value. It appears to you that vaccines take. So I saw it on social media. Vaccines take 10 years to develop. How are we able to develop in 1 year? This was because that time there was no discussions between researchers. There was no live interaction between scientists. There were phases. There were government issues. There were issues with getting people for the trials. This has all changed, and we are having now simultaneous phases of the vaccine licensing that is happening. So therefore, we are doing it quite faster than it used to be, and therefore it is not a concern if you approach the problem scientifically. Of course, there will be some people who just don't want and would rather take a risk getting the disease than the vaccine. It's a personal choice. So I also feel that if you don't want to take it, it's your choice. But you should be informed about what is happening and have a scientific approach to it.
that kind of sounds like a risk zone to me, because then we kind of are throwing two kinds of people into the same pool, because people meet at workplaces, people meet at other kinds of social gatherings, markets, cinema halls, etc. Things that are not working at full capacity may open up, and that's what every government would want to do. Uh, will the people who have gotten vaccinated, having been injected with small amount of the virus in order for their body to acclimatize itself, uh, uh, start acting like silent spreaders to the people who have chosen not to take the vaccine and also have not been infected with this virus before? Is that possible?
I couldn't get the last
I
part
said,
of it. So you're worried about the.
will the people who have not gotten vaccine and not been infected be at risk of being infected by these people who have gotten the vaccine?
No, in the sense that basically
I'm
what I'm
sorry.
trying to understand is that the question is whether a non-infected person will get infected from a vaccinated person. The chances are there, and therefore I said in the earlier instances that you have to wear a mask. So you could be transmitting the disease, although the chances would be very, very less, and we still have to get more data because this vaccine is not to prevent transmission primarily. That's not the agenda behind doing the trials. The agenda was to save yourself first. Uh, Likewise, you don't have to get worried from a vaccinated person. You have to get worried from every person basically, because the every person that you're meeting in the office in the marketplace can be carrying the disease asymptomatically and giving you the disease. So therefore, targeting or thinking that the vaccinated person is going to probably give the virus is not the smartest thing to do. But yes, if you are not vaccinated, you could get infected from anybody. It's not just a vaccinated person; it could be anybody under the sun who you are close to and you are exposed to.
Right. A little bit of, sort of a political question there. So, in the past, also, the history around vaccines is very controversial with respect to the Asian and African countries. Most of the vaccines have been not only vaccines, but a lot of medicinal experiments have been done in African and Asian countries, let's say contraceptives for that matter, or polio-related vaccines, etc. So, it's a, a lot of people out there in India also feel concerned that we are the first ones being vaccinated here, and probably we are still in the testing phase, and we are being made the scapegoats.
No, not really. So, in terms of vaccines per se, if you see the data, all the Moderna, Pfizer, even AstraZeneca, the Covishield that we have got per se, has been tried in across the globe in many places. In UK, especially UK, there is US patients, people from Brazil, so there are people from Europe as well. So it's not just African. In fact, probably Covishield or COVID vaccines are very less people have been tried in Africa or in the southeastern part of the world because our numbers are not that great initially. So even for the AstraZeneca part of the vaccine, there were some centers who were giving the vaccine in India also. So there has been trials. So in terms of things, whether the poor countries or African countries, Indian countries have been used as guinea pigs, the answer is not no. It's not like that. If they want to have a dengue vaccine, where would they try? Where would they do it? Not in America because they don't have dengue though. So it has to be in places where the disease is profound, right? So likewise, if they have a malaria vaccine, where do you think they're going to try it first? Africa and India because that's where malaria patients are there. In terms of therapeutics or drugs for HIV, but again, where is the trials going to happen? The trials happen across the globe. It's not just in Africa. It happens more in Africa because the number is so high that it's easier to get participants. So there have been so many trials, even in China, towards the end. There were some trials which were stopped, like for plasma trials, and some other trials which stopped in China because they stopped getting participants for the trial. So therefore, I don't think it is restrict or it's something that you need to be really worried about that we have not tried and tested. The fact is that we have tried it. The vaccines have phase 1 and phase 2 efficacy trial, and these are similar to how previous vaccines have been advocated. Nobody bats an eye when we said that influenza vaccines have to be taken, but that's also gone through the same kind of phases. So I don't think that should be a concern as of now.
Doctor, with COVID, the most tricky part has been that an individual had no way of knowing how their body is individually going to react to the infection if at all they got it. Some people were, like you said, asymptomatic, while the others went into ICU, and some could not even survive uh, the infection. Now, what I wanted to understand was if, let's say, everybody is getting vaccinated here, everybody is getting the shot, um, will that small amount being injected in you throw you into that kind of medical complications? I know you've already answered about the side effects of it, but I just wanted the viewers to be more specifically informed about concerns that are bothering them the most in terms of the medical concerns.
No, I don't think that there's any competition. See, you have to understand how this started, right? In the month of March and April, where the whole world wanted something, everybody had to start somewhere, right? So everybody around the globe started thinking and researching and trying to get answers. So everybody came up with some answers. Now, if you're comparing which answer is better than the other one, only time will tell. So only with time will we realize if something is better than worse. So in the future, you might have, if we are going to have enough number of COVID patients in the future, you might have a head-to-head trial where you might see Moderna vaccine versus Covaxin, given simultaneously in the randomized control trial. You might see that in the future as well. So I don't think this is a pharmacy ruled competition. This was basically done for the benefit of the human race. Uh, are they going to really? Otherwise, how are you going to move ahead? Suppose we had just one vaccine and everybody had to given that only, we would not have any other options, right? So this is the time where we are still in the mix of knowing things, but whatever we have in our hands is safe. So first of all, safety is not a major concern. Whether it is going to be really effective or not is what is going to be seen in the future as such. So what happens in the trials and what happens in day-to-day activities is completely different. So only in the coming days will we realize, okay, we vaccinated so many people and therefore the infection rate has come down by this. That only time will tell.
Also, Doctor, soon this vaccine is going to be privately available as well for the people who want to go and buy and get themselves vaccine. Will the government free shots continue for the marginalized sections, or will it only be something that you can buy and get it yourself?
Your guess is as good as mine. So I don't know what the government has in plan for our people. I think the ideal situation would be that we all get the vaccine, but that is an ideal situation. What will practically happen, I think only time will tell. The reason we are giving the first-time workers or healthcare workers in the initial phases is because they are the highest risk of getting the disease. Uh, so therefore, they were the first ones to get chosen. But in the future, if you want to really, from the person, from a watchman in a hospital or in a building to the prime minister, everybody is at risk of developing the disease. Right? So there have been ministers who have died. There have been common people who, like you and me, who have also died. Everybody should probably get the vaccine. Will it be free or not? I hope it is, but I'm not sure if it really happen or not. Only time will really tell.
Lovely. We have a couple of people watching this show right now with us. We'll give them a minute or two uh, for them to ask their questions if they have any, that is. In the meantime, Doctor, my question to you is, did you get the shot? How did it feel to you individually?
Yeah. So even I was a little apprehensive looking at all the apprehensions surrounding me. So I have got this shot, I think 4 days back. Yeah. So it's like any other vaccine because anaphylaxis was a risk concern as such. So we had for half an hour post the injection there itself. So in case there's any issue with the vaccines per se. Till now, in our hospital, nobody has got any major anaphylaxis as such. The only concern has been a little bit of fever, probably for 24 to 48 hours, and then simple paracetamol does the trick. A little body ache. I think that's about it. No other major issues were seen, at least at our center as such. And that's been the case across the country as such.
How are you feeling today?
Yeah, I'm feeling absolutely fine. There's no issue as such, and the apprehension has come down. Seeing people who have experienced and who have understood the disease process. So when they take it, it's so when Dr. Fauci takes it in the US, it goes to show that when the president of the US takes vaccine, it goes to show that they accept and they understand the importance of the vaccine. And likewise, when we also have people in the public in the public space taking the vaccine, I think it will promote more understanding and reduce apprehension of the common people. Because if, suppose tomorrow Amitabh Bachchan is taking a vaccine, is putting a photo on Facebook or on Instagram or on Twitter, that will give a sense of understanding, or will relieve
Confidence.
some amount of apprehension from the common public as well.
Doctor, is there anything else that you would want to add to this interview from your end that we may not have been, as non-medicals, not have been able to point at?
No, so the most important question that comes across is whether we really need to take the vaccine, especially now when the number of cases are so less. So the answer to this question is we still don't know what the future holds for us. So in the UK and the US, it is relentless. The infection is relentless right now. Is there a possibility that it will happen in India again? The answer is yes, it can happen. Will it really happen? The answer is nobody knows. So would you? It's the gambling sense in the person. So would you gamble that it's definitely not going to happen versus a vaccine that may work? Is a personal decision. But what I want from the public is to understand the options, they understand the benefits and the risks, and then take an individual decision. So many people know that using IV drug abuse is bad. So many people know that helmet is a necessity while driving bike, but many people don't choose not to. So it's a personal decision. But for the greater good of the race and yourself, I think it would be advisable to take the vaccine. But again, the personal choice is always personal.
Conclude the session. सुना ना आपने, डॉक्टर कह रहे हैं और बहुत बहुत ही ज़्यादा कॉन्फिडेंस से कह रहे हैं आपको कि इसलिए नहीं कि आपको ज़रूरत है या पड़ेगी, इसलिए क्योंकि जब आप बाहर जाते हैं रोज़मर्रा की ज़िंदगी में जद्दोजहद में फंसे रहते हैं, आप हर बार सैनिटाइजर नहीं याद रख पाते, मास्क भी कभी खिसक ही जाता है, तो बुरा कुछ भी नहीं होना है आपके साथ। वो कह रहे हैं जरा सा 24 से 48 घंटे के लिए बुखार आ सकता है, लेकिन कोई फर्क नहीं पड़ेगा। अगर आप नहीं लेते हैं तो आप कहीं ना कहीं डर के साथ जी रहे होंगे, न जाने क्या होगा। लेकिन अगर आप ये वैक्सीन ले लेते हैं, बुरा तो कुछ नहीं होगा, अच्छा जरूर हो जाएगा। तो ले लीजिए। डॉक्टर फजल आपके साथ हैं, आपके सवालों के जवाब उन्होंने दिए हैं और उन्होंने खुद ही वैक्सीन ले ली। तो ना ही फ्रंट पर रहकर इन डॉक्टर्स ने सिर्फ लड़ाई करी हमारे लिए, खुद को एक्सपोज किया, वैक्सीन लेने में भी वो सबसे आए। आप इनकी बात मान ले या पड़ोस में रहने वाले शर्मा जी, चोपड़ा जी और फला जी की बातें मान ले, चॉइस आप ना लेना चाहें तो वो भी आप करने के लिए आजाद। On that note, humanizing lives cares for you. Humanizing lives looks after you. Get in touch with us. Let us know your concerns and questions. We'll keep answering them through experts. As long as you want it, we'll get it for you. On that note, thank you so much, Dr. Fazal, for your precious time.
Thank you so much for the invitation.
Thank you so much to the Humanizing technical team and the audiences that we've had today on board. And the session is, of course, being recorded so that people who come to our social media forums can get the information shared here today with us. Thank you so much, Doctor, for sharing all of the things in detail with us. Thank you. Have a good evening. मुस्कुराते रहिए और ना मुस्कुरा पाए तो हमसे आगे बढ़िए. Thank you.
Stay safe. Bye-bye.
Good night to everybody. Stay safe.